Introduce myself. My name is Marshawn Graves. You cannot see me for some reason. We haven't figured that part out yet, but my name is Marshawn Graves. I'm the Associate Director of Admission here at PLU. I've been here for a half a year now, so we're getting there. We're really getting there. Yeah, yeah, yeah. I'm trying to hit that year mark, and but I've been here half a year, so that's a little bit about me. And I'm going to have the rest of our team here introduce themselves and tell them what they do here and what year they're in.
Sure. Hi, everyone. My name's Heidi Brocious. I am the professor of social work and chair of the BSW program, which means I provide administrative oversight for the undergraduate aspect of the social work program.
Yeah, I can go next. My name's Emily Alisea. I'm currently a second year here at PLU. My major is social work, so I have a lot of experience with that so far. And then I have a minor in communications. I do quite a bit of other stuff around campus. I play golf on our golf team. I'm also a tour guide with the Office of Admissions. So that's some of the stuff I do around campus.
And you're on our club, right? You're an officer in the Student Social Work Club. I'll just call you out.
Yeah, I am the underclassmen representative for the social work organization.
My name is Luke Newmeister. I'm also a sophomore, double major in sociology and social work. I am also involved with the Creative Writing Club of being the secretary and a part of our club lacrosse team.
All right, nice. Appreciate y'all for joining us. We're glad to have you around and really looking forward to the insight that y'all can give to some of our interested students. So, Dr. Heidi, will you give us an overview of your program and
Sure.
just tell us what y'all a little bit of what are y'all about?
I'm going to go ahead and share my slides for now. And this is just to help sort of keep me on track. Oh, it's asking for a request here. So you have to
Yep,
grant.
I'm going to allow right there.
Okay. So, welcome to social work. If we could do more interactive pieces, are you seeing the screen? Is it showing the slides?
Yep, you're good, doctor.
Good. I'm not able to see that part. Okay. Oh, it's because it's up on the screen. Got it. All right. So, social work, I would love to ask the folks in the group if we were able to have that. So maybe if you can and you're willing, post in the chat, like, have you heard of social work before and what have you known? Because a lot of times students come to college not necessarily having heard of social work, or if they have, what they think of for social work is, oh, those are the people that remove children from homes. And that's the exclusive thing that social workers do. And I'm not particularly interested in that. But social work is actually this really broad profession that encompasses lots of different aspects of helping people. Here at PLU, social work is under very intentionally in what's called the College of Health Professions, because social work is seen as a professional health role, right? So we are involved in both behavioral health, your mental health and well-being, along with well-being and health, right? Physical health. And so our degree is housed with nursing, marriage and family therapy, and kinesiology, all programs that are leaning into health. And social workers do a tremendous number of things. We certainly are involved in child protection, but that is not, as I mentioned, the biggest aspect of what we do. We are really in every area of the community working for health and well-being. So social workers that are out in the community are often working with individuals. So many of you may not know that if you go to see a therapist in the community, something like 60% of all therapists are a master's in social work trained. So we provide a great deal of graduate level mental health therapy. We also work in groups and communities. We are organizers, we're activists, and we look towards community health and change. It's a profession that's grounded in the ideas of inequity and social justice. Our commitment as social workers is to those experiencing poverty and who are oppressed. And so if you're particularly committed to social justice kinds of aspects of well-being, social work is a really great fit for that. We're also a developmental profession. So understanding humanity across the lifespan is a really important part of being a social worker. So in the social work program, you learn a lot about what does it mean to be a child born, right? And both physically, developmentally, spiritually, cognitively, socially, all of those environments, and how do they translate across the lifespan? Because there's room for social workers at birth, right? I've been a social worker at the hospital, where I've helped families welcome new infants into their home and help them transition to that process, all the way through the end of life, right? Where you're working with families on making end of life decisions. So social work across all of our lifespans is really important. So if this sounds interesting to you, social work might be a fit for you. The social work curriculum here at PLU, as you heard from Luke and also Emily, one of the things we really value here at PLU is the ability to do social work and other things, right? Because your social work profession is enriched by learning about sociology, about expanding your creative writing, around learning aspects of business or psychology or those things. So one of the things I really appreciate about PLU is you can do two things. You can study music and still have a social work career, right? You can get engaged in communications and be a communications major and learn about sort of aspects of social media, while at the same time learning to do that for work with people in the community. So social work is also a really nicely layered kind of degree. And it, you know, if you do one thing at PLU, it doesn't mean you can't do the other thing, which I think is kind of an exception at PLU. Lots of other schools, you kind of lock in and you don't have that opportunity for breadth, which is something I really value here. Some classes that we, this is the long, boring list of social work classes that are required as the major, but we'll touch on these a little bit. So one of the first classes you take is anti-racism, diversity, equity, and inclusion. And this is an opportunity to look at how equity and opportunity and systems have moved to oppress particular groups and what we can do to disrupt that and monitor our own selves in the context of human well-being for everyone, right? Not just the able-bodied, right, and members of the majority. We are interested in research. I always tell students, research is advocacy. If you know how to argue with someone about data, you know how to advocate for things. So we do some research, but we keep it in the context of human beings and meaningfulness, right? As I mentioned earlier, we're really interested in the development of human beings. So you take two courses, Human Behavior in the Social Environment 1, which is what's going on biologically, psychologically, socially, environmentally, and spiritually from birth until adolescence. And then you jump into Human Behavior in the Social Environment 2, which takes you from young adulthood into end of life with those same kinds of constructs, looking across biological changes, psychological changes, the social environment, your spiritual environment, all of those things become important in understanding the whole person. We take a look about our history and policy in social welfare. So that's a class, I think Emily and Luke are in that class with me now, right? So we spent a lot of time talking today about past historical events that look a lot like what we're going through right now, right? And what can we learn from those things and how do we shape policy and well-being around those things? One of the things that a lot of students love a tremendous amount around social work is it's an action profession, right? So when you're in social work, you're immediately going to start doing. So in one of the classes you take is practice with individuals. And this is where you learn the beginnings of therapeutic work, right? Emily and Luke, you guys are in this class too, correct? Yeah, so you're learning about that. How do you do interviews? How do you act as a helper in counseling one-on-one with people for different situations? So it's a lot of skills around that. Then where you head in your senior year, and this is true for every student, is our practice practicum sequence, which means that you are taking classes about how to run groups, how to work with families, while at the same time you are in an agency under the supervision of an experienced social worker, learning how to do the job. So during your senior year, for 16 hours a week, we make space for you to be at the local school, at the Boys and Girls Club, at the community outreach center, at the counseling center, at a variety of different places that you might be interested in working. And we find that a lot of students wind up going to work for the places, right? They go, they're interning, and then the agency says, I can't live without you, Emily. And therefore you find yourself with a job at graduation. So that happens a lot too. As I mentioned earlier, we see students, there's space in the social work degree to double major or have a number of different minors if you're so inclined, and some really common majors that our students seek out in combination. We have a number of students that dual major in Hispanic and Latino studies. So a lot of times those students will go spend a semester in Oaxaca, and we work with that program. We actually have 2 students right now getting social work classwork while in Oaxaca to stay on the program, Oaxaca, Mexico. And so they are able to manage those demands simultaneously. Like Luke mentioned, Luke is a sociology major, so a more research focus in addition to the practice focus that comes with social work. Luke's leaning into the understanding of larger systems through research in ways through his second degree in sociology. We also see lots of psychology, right? People that want to go on and do mental health are interested in the psychological aspect as well as the social work aspect. So they blend really nicely together, and we have a wonderful relationship with our psychology department. I've had a number of dual majors in religion. So students that are interested in studying religious philosophy, religious approach. We had a student last year whose entire capstone project was on how do you support a church faith community respond better to domestic violence. So it was a training program that she developed. So that was an overlap of those two. And then a number of students who do GSRS, as we affectionately call it, or gender, sexuality, and race studies. So that is absolutely an enhancement to our program. As I mentioned, every student that comes through the program will are required to get 400 hours plus. It's actually 420 hours in the field. So by the time you graduate, you will have spent more than 400 hours in actual practice under someone who's a practicing social worker for at least 2 years. And that's something that we hold up in a social work degree as such a great thing. When in your life do you get this chance to be mentored for an entire academic year by somebody who's right there in the field? So it's one of the more meaningful parts. And then you come back to campus each week and you process that and you talk about what you're learning, and you have a cohort of your other students that are doing the same thing. So it can be a really dynamic senior year. And then also, a minor in social work is popular. Particularly, we are encouraging this among our nursing students. So if you're interested in nursing, a lot of times you have room in that first 2 years before you really start into the nursing program. And that's a great opportunity to learn about working with people, because as I told many nurses, right, it's all well and good to know how to do an IV. And I certainly want my nurses to know how to do an IV, but they're also dealing with families and issues and situations. And so having some social work skills under their belts can help enhance their nursing skills. So we encourage that partnership as well. What can you do with your degree? Those are the big questions. And also, what do you make? I'm going to address that a little bit too, because a lot of times people say, oh, social workers, they don't get paid very well. So we'll get back to that in just a minute. But a number of degrees that are available, or excuse me, a number of jobs that are available to you when graduating with a degree in social work at PLU is case manager. So we have a number of students that go on and in mental health settings or in housing, homelessness situations, help manage the cases of people who are struggling. Healthcare is a huge, huge area for social work. So one of the things that healthcare insurance companies have learned is that if you have a social worker involved, less high expensive medical care is often needed because social workers do the prevention piece. So in every hospital and in many health clinics, you'll see social workers there working on problems of discharge, access to equipment, social isolation for elders, some of those things that lead to hospitalization, social workers can intervene in and prevent. So we see a lot of social workers in the health. Obviously, youth programs, after school programs. We have a number of students that work in the Pierce County Communities and Schools program, which is about enhancing outreach. Leadership winds up being a big part. You find if you go to work as a social worker one day and 3 weeks later, they'll be promoting you to the directorship, right? And so managing programs, managing staff can also be a big part of what social workers do. And then counselors at social and health services. I also want to tell you one thing that I think is really exciting for those of you that really know that you want to be a mental health therapist. You want to be able to sit down with clients in a community mental health center and work through therapeutic processes. And that is that 2 years ago now, PLU launched its brand new Masters in Social Work program. And so one of the benefits of this is that if you get an undergraduate degree in social work, you are able to complete the master's degree in 1 month plus 2, well, excuse me, not 1 month, 1 year plus 2 months. There we go. Get your facts straight, Heidi, right? So someone like Emily, who's going to graduate next spring, and I know she's going to hop into our master's program. She'll start that in June. And 1 August later, Emily will have her graduate degree and be licensable as a mental health therapist. So it shaves a tremendous amount of time off of your graduate degree if you know where you're headed. It also saves you money, right? So, and we are really invested in our undergraduates staying with us. So one of the things that also happens, as long as you maintain your GPA here, you get automatic admission to the graduate program. You don't even have to apply. As long as you've done the things you need to do and maintained an appropriate GPA, sail straight in, and you get a tuition decrease, right? You get $5,000 off your graduate tuition. So we really try to make this for people that are like, therapy is where I want to go. It's a very straightforward course of doing a social work degree, bachelor's, jumping into that master's, and 1 year later, you're in a situation where you can be a community mental health clinician, which is pretty exciting stuff. I want to go back to the question about how much money social workers make. And I think that's a changing landscape, and I don't want to throw around numbers, but I remember when I was getting my social work degree, everyone saying, don't social workers pay terribly? And I just want to say I've been now in a career of social work for 30 years, and I have lived very comfortably, right? So social workers right now tend to make at least as much, if not more, as public school teachers. And there is a really big gap between, I will give some ranges. I see ranges right now in the mid 40s to the mid 60s for baccalaureate level, right? And then after that, you begin to see 60s to 80s for somebody who has a graduate degree. So adding that extra year really does give you a boost in terms of your potential income. So it is, it's not, social work doesn't generally produce billionaires, but what social work does produce is people that can pay their bills, live their living, and really enjoy and appreciate and feel value in the work that you do, right? Social work is the kind of profession that has you feeling like I'm doing the important stuff, right? So I just wanted to speak to that a little bit. So that's, I think, all that I've got for an overview. So I'll stop sharing, and Marshawn, I'll let you guide the questions from here, or if you want me to engage with the students a little bit, you let me know.
Yeah, no, I'm gonna drop in here, drop whatever questions the students who are participating, the attendees, whatever questions they may have in the Q&A. And then we can go from there. But I do have some questions that I would like to ask, if that's okay with y'all.
Yeah.
So I will start us off. But for me, what originally, and this is for each of y'all can take your turns, whoever wants to go first. I'll start with you, Doctor. What originally drew you to study social work?
That's a great question, and I'm really excited to see how Emily and Luke respond to this. What drew me to social work? I wanted to be a therapist, right? I was really intrigued by that idea, and I actually started in a program that wasn't social work. And I thought, this doesn't feel quite right? Like, this doesn't feel as community centered. And somebody said, gosh, you sound like a social worker. Maybe you should look into that, right? So I completely stumbled into social work. And I remember sitting down in my first class and hearing about this idea of inequity and justice as a part of mental health. And I thought, these are my people, right?
Yeah.
Because I really live in a world where I see what's happening out in our world is so connected to who we are and our functioning that I was not able to separate that off and just say, oh, Heidi's, problem is this. I see any problem I'm having is interconnected with my environment, with my community, with the systems, with our history. And so that sense of realness that social work brings was really important for me. How about you guys?
I can go next. So I actually came to PLU as a nursing student. I was direct admit to our nursing program here. I knew growing up that I always wanted to help someone in the future, whether that was being a nurse or a physical therapist or a normal therapist or a social worker. I've thought of myself being all of those before. So I've actually switched my major 4 times at PLU. Like I said, I used to be nursing. I shortly after that switched to kinesiology, after that to psychology, and finally landed on social work and stuck with it. I think the work that we would be doing as case managers or whatever you decide to do in the future with the social work degree is not only impacting your life, but it's impacting so many other individuals' lives. And I've enjoyed all the classes I've taken so far and find the materials we're learning in class very interesting. So I'm glad I picked to be a social work major.
Me too.
At least for me, I came to PLU as an undeclared major because I thought I originally wanted to go into graphic design or psychology. So I kind of took both and took at least sociology and social work in like a broader sense of both of them. So yeah, I don't know. It was kind of weird, my thought process, because I took a lot of sociology and social work classes because I knew I could double major. and I fell in love with all of them that I decided to just go down the path. And my mom is a lawyer, so I kind of saw a little bit of what she did with nonprofit. So um I really enjoyed seeing like her work, so I kind of want to go into a similar career.
Nice. Nice. Um, you answered some of my most of my questions in with your presentation. Um, what are some of the other misconceptions besides low wages that you
Yeah.
often see people
Yeah.
kind of bring up? And anybody can answer this. It doesn't have to be you, doctor, but what are some other misconceptions, for you, Emily? What was a misconception for you as people were like, "Oh, you're changing your major from nursing. You're going to be this." What were some of the things that you heard when you said you were changing your major?
Yeah, I remember when I first changed my major from nursing to kinesiology, my dad was pretty upset about it. He was like, I thought you were going to be a nurse forever. You've talked about it forever.
Mhm.
He came to the understanding pretty quickly. When I told him I was switching my major to social work, the first thing he said was, how are you going to be able to handle the mental capacity that being a caseworker and working with students who are going through super challenging and hard times? Like, how are you going to be able to handle that? And honestly, I was really nervous about it at first. I was like, oh, he's right. Like, how am I going to do that? But being in the social work classes at PLU has taught me different strategies and ways that I can handle that and put my emotions to the side to put my clients' emotions before mine and really make sure I'm able to take time for myself and figure out everything in that sort of way. So that was a misconception I heard of a lot, that it's going to be pretty mentally challenging. And like, granted, yes, that is true, but the professors here give you strategies and how to deal with that. So that was something, yeah.
If I could just add to that, one of the things I think is true is helpers are helpers, right? And so, Emily, whether you did a social work degree or didn't, you were going to be a helper. And now what you have are strategies for managing self within that and setting healthy boundaries that are both inviting to clients, but also protect you. So helpers are helpers. Social work gives you some of the tools to be the best kind of helper that doesn't sacrifice your whole being to help others.
Yeah. I've when I first told like my friends that I was changing majors to social work, they were always like, yeah, I see you doing that. I feel like to be a social work major, you got to be a certain kind of person. You got to be charismatic. You got to be empathetic. And those are just all qualities that all the social work majors I've met have. So you can definitely tell when someone's a social work major when they say that. You can be like, yeah,
Mhm,
that makes sense.
mhm,
I see that.
mhm, 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 mhm. That makes sense. What about you, Luke?
Uh, for me, I kind of had to, I guess through my experience on why I picked social work is I've generally had throughout like my like high school and kind of like my childhood, I would kind of like sit with my friends because I knew that they struggled a lot because I'm a little bit like better off with like finances, I guess, with like my
Mhm.
parents and stuff.
Yeah.
But apart from that, I knew that some of my friends struggled, so before I even knew that I wanted to go into social work, I've had like a lot of my friends kind of just like talk about their life and told me that I'm very like empathetic and
Mhm.
that I'm a really good listener because I know that struggles are real,
Yeah.
especially for me because I'm adopted and I through that I kind of like understood that like, oh yeah, I could struggle in certain ways
Yeah.
or don't really know where I would be from that. So it's just like I don't know. I guess in a way, I'm kind of more like down to earth and understand people's struggles.
Okay. Um, and I don't know if if Emily and Luke, if y'all are in your uh practicum yet. Are y'all in your practicum yet? So not there yet. Okay, so Dr. Heidi, do you have any memorable experiences from students that you can share that from their practicum site or community placement that you can?
That's a great question. Yeah, absolutely, all of the time. We had several students last year. It was a really powerful time. They were placed at for those of you that aren't local, at a agency called Tacoma Community House, and that's when the practices and approaches around immigration really began to change. And so We had a student last year who was there during this big transition of immigration policy restructuring, and her role there was incredibly powerful, and she was bilingual. So her ability to serve the clients at Tacoma Community House became a really powerful part of her work. I think she was more moved by that in terms of her engagement. I'm trying to think of what other amazing places we've had. Right here on campus, we have something called Weezer, the Wellness Student Center, and we have a number of students that get placed there and are engaged in things like helping with the food pantry on campus and engaging students who are experiencing social isolation. So some students get to do their social work right here on campus. We always have a student down at the local middle school. Last year we had a student who was at Keithley Middle School who helped launch what's called a positive behavioral supports program, right? So helping kids get rewarded for positive behavior. She built what she called the Colt Store, where students that had positive behavioral interactions could come and get rewards and prizes for their behavior. So yeah, they're all over the place doing all kinds of cool stuff.
Luke, Emily, is there anywhere you want to go?
Yeah, so I actually just got my practicum placement for next year at Weezer, which is the Wellbeing Service and Resource Center on campus. So that's what I'm going to do next year. But I wanted to talk about two experiences I got before my practicum placement where I was able to, with the social work department, go into the community and do stuff. So the first thing I did was I took this class called January on the Hill. It is a community-based class where you go into the local Parkland, Tacoma, Lakewood area and just get hands-on experience. So one thing we did was we worked with Habitat for Humanity where we got to go. And I was literally in the month of January in the freezing cold just building a house. And I know that sounds terrible, but it was actually so much fun just getting to talk with my classmates about, oh, why did you pick social work? And that's when I was still questioning on switching my major. So it was really cool to hear their perspective on how why they picked social work, and that obviously influenced me a lot, and that was the class that made me pick social work. And this January, I actually got to study abroad in Tobago with the social work department. Down in Tobago, I got to have an internship at the Division of Health and Wellness. I was set at the site called ADAP, which stands for Alcohol and Drug Abuse Prevention Program. And in Tobago, we were able to go out into the local community, schools, the hospitals, the detention center, and present about drugs and its impact it has on your body and your mental well-being, and just seeing how receptive the kids were and the adults at the hospital, being able to take in all of that was a really great experience. So I'm really glad I got to do that too.
For me, I can say probably don't have much experience as Emily does. I was also on the Tobago trip at the division, and I worked with what they call the TCU, which is the Therapeutic Counseling Unit. And through that, I got to visit a suspended school for kids in high school who got either expelled or suspended. And so just seeing that was eye-opening. And then I also got to work with adults at this place called Folk Tech, where they suffer from disabilities. So just seeing that. And then I also did intake sessions for 2 domestic violence cases. And I guess one thing, if I can say, is I want to go into law because I just worked at a law office this past summer. So that's something that I also know I could go in a different path, at least with social work. So that's a key interest I have.
Nice.
Something just to throw out there is it's not true at PLU, but there are several programs around the country where you can do a dual master's in social work and a JD. So you can become a lawyer while becoming a master's social worker. And often those are positions of legal advocacy where you're really learning how to legally advocate for the underserved. So that's not at all uncommon for social workers to lean into law from a justice perspective.
Okay. This is for Emily and Luke. What's one thing you wish you knew about social work before you started the major?
One thing I wish I knew about social work would probably be that I didn't realize we would get as much hands-on experience as we are. I know for a lot of other majors at PLU, their practicum or their internship is only going to be a semester long, and they only get about 160 hours compared to us who gets 420 hours or more.
Yeah. Yeah.
I wish I knew I got that much hands-on experience. I actually didn't know that until right now. So that's pretty cool to know. So yeah, I think that we get so much hands-on experience and we get to apply all the theories we're learning in class into the real world.
Gotcha.
And the way that senior year is designed, you're in a class learning about how do you run a group. And then you go to your practicum and your practicum says, hey, run this group. And then you come back to your class and say, I'm starting this group. How do we get it started? So it's this interwoven connection between learning skills to use with people and then immediately going the next day, and if appropriate, trying at the setting that you're in under supervision. So it is a very hands-on senior year.
One thing for me going into social work was the options you can go and different outcomes you can get through that. I knew that in some ways you can be like just a normal like social worker, a therapist, work in like school settings or maybe like medical social work. And yeah, so just like seeing that there are more options that I could also go into and succeed in those if I have an interest in them is really amazing, especially with the MSW if I were to go down that route. So just having all those options is just amazing, and I can apply the like skills I've learned through the classes in those.
Okay. And lastly, and anybody can take this question first. But what advice do you have for those who are in the Zoom with us, and for other high school students, seniors who are considering this field?
I think that's a great question for you guys.
Yeah, I can go first. My advice for people who are considering doing social work is do it. It is such a great program. I hate to be biased, but I definitely think we have some of the best professors, shout out Heidi, around campus and throughout our department. And just everyone being so inviting and welcoming. And all of my classmates I've ever had interactions with are always positive. We always like wave at each other, even if we've just had a little class together. So I think the social work department is, if not the best department at PLU. So I highly recommend even just looking into it a little bit more, getting to know more about it and anything like that. So I recommend checking it out, at least taking one social work class to see if that's what you want to
do. Honestly, I would have to say the same thing as Emily, just like take a couple classes, go for it. And the faculty is just super amazing. They're very laid back, and all the people, at least students wise, that you take classes with are also just very fun to hang out with. And you can build a tight knit community with everyone. And it's just, I guess it's just very like humbling in a way because yeah, you can go into a career that like you might not think you would even like and just get so many like beneficial factors with everyone.
Gotcha.
I see that there's a question in the Q&A. So what are the classes like?
Yeah, it just popped up. You own it.
Yeah, go me.
Yeah, you're on it. Yeah, it just popped up. Go ahead.
Yeah, so I'm going to describe one of the classes I literally had today. It's Social Work 360. It's practice number 1. And today we went over all the theories we did in our take-home homework, which was like a chapter of reading, and we learned about a couple different theories. And then most of my social work classes do these things called role play, where the professor sits across from you and you get to be the social worker, and the professor is role playing as the mock client we have for the day. And then you get to put on your social worker hat and ask them questions like you're asking a real client the questions, and they will either like be snappy at you because you never know what a kid's going to do, or they might be really shy and quiet, and you have to think on your feet how to get them out of your shell. So I think most of our classes incorporate that somehow, and that I really enjoy because I get to have hands-on experience with a professor who truly knows what they're doing and what they're talking about before I myself go out there and do it. So I would think most of the classes are like that. I've taken 4 social work classes at PLU, and they've all had some sort of role play action in it. So that's how I would describe class.
Luke?
For me, I guess social welfare policy and history, it's very fun because at least one of the events that we got to do is Lobby Day, which we did last week on Tuesday. And I guess that is just more advocacy work. And I thought that was really interesting on seeing like what goes behind that and having everyone just be I just lost my train of thought. But I think what I was gonna say was like just being like super outgoing, just be coming together just to like try to make a difference for different things. And then just like learning about like, oh, like how many things in history also get resembled today, which was something that we learned in class earlier. And yeah, so just like seeing the process of all that is really interesting.
Luke, I'm so glad you brought up Lobby Day, Marshawn. So these students went down on Tuesday to learn about the process, but also to lobby for scholarships for students. And they had such an impact down in Olympia. That's a bill that we thought was not going to get any traction. The Senate. And it was really as a direct result of Emily and Luke and their classmates going down and making connections with state senators, sitting in on hearings, making their voice known. So it's been a really exciting, like they've had instant power in the advocacy class, which has been really cool.
Good job, Emily and Luke. We appreciate y'all. I mean, in the work that y'all did, not only is it going to benefit y'all, right? It benefits those that are coming after you too.
Absolutely. It only benefits those coming after them. It's a cut in a couple of years. So work for others.
Yeah, definitely a selfless act, and I think that's part of the reason why y'all are social workers. You know, and y'all see others in mind before yourself. So we appreciate that. Does anybody else have any Q&A questions for us that we can answer or that they can answer more? Yep, we got one.
There's another one. Yeah. Are there any options for clinical social work with internships? What do they look like?
That's a great question. So you can, so in the land of clinicalness, right? We tend to think clinical work tends to mean therapy, and you generally need a master's degree in order to be a therapist, but there can be other layers of clinical case management. So that's a really common thing at a baccalaureate level. And we have students all the time at community mental health. And so what you'd be doing then is meeting with someone who's experiencing a mental health crisis. You'd be talking with them about what services they need, what supports they're encouraging, and then you'd be linking them to those services, right? And then checking in with them, helping break down barriers, right? If the issue is you can't get to your appointment, what can we do about transportation, right? If the issue is motivation and stress, you can work with them on some motivation and on some stress management. So clinical tends to happen at that master's level. So again, I'll use Emily and Luke as an example, hoping that they both decide to come onto our master's program. If after next year, Emily does her placement at Weiser, where you're helping, again, more of this case management networking kind of thing. Then the next year, when Emily's in her graduate program, she will likely have a clinical placement that will either be at the hospital where she's doing mental health assessments, among many other things, or it could be at a community mental health center where she's doing therapy under the supervision with other clients because she'd be in her second year. So a lot of the real clinical work comes in the graduate program, but I would call clinical adjacent work is really common for social work practitioners. And it's what Emily will be doing next year.
Yeah, you basically hit exactly what I want to do on the dot. So go you. There's another question in the Q&A. What qualities do you need to succeed as a social work major and have a successful career? I can answer that one if you guys want.
Go for it.
I think the qualities you need is determination. You need to have some sort of empathy for others. It's really important for determination. I mean, it's a lot of textbook reading sometimes. I will admit, Heidi, maybe keep it down a notch. But The chapters are always really interesting to read. It is very important that you actually do read them because that's where you do most of your learning. And then when you go to class, you can talk about them with your fellow classmates. So that's where I think the determination comes in. You also have to be pushy for what you want. Your practicum placement is fully up to you. You have to be the one doing your background check, scheduling your interviews, attending those interviews, and making sure you are prepared to your best standards. So I think determination is very good. And also for a successful social work career, you have to be empathetic towards others. You never know what someone is fully going through unless they tell you straight up. So you have to make sure that you are listening to other people's needs and doing your best to see what you can do to give them.
Great answer.
Luke, you got anything you'd like to add on that?
I kind of have two themes, but I don't know if they relate. I would say maybe open-minded and then being optimistic because those two factors definitely have a key aspect in social work. Because I think at least being optimistic, you don't know what you're gonna get, and open-mindedness. So it's just like you have to kind of be quick on your feet on like what you're gonna be given on a day-to-day basis and just kind of adapt to like a certain environment, especially if you're going to be doing something with therapy. And yeah, and I guess that also has to tie in on what Emily was also saying.
Yeah, for sure. Dr. Heidi, anything you think might be important for traits that they might have?
Here's what I would say is my most difficult lesson that I'm still learning every day is that social workers walk with people. We don't put people where we want them to go. And so as a social worker throughout my life, especially as a young social worker, I was always thinking, if they just do this, if I could just get them to do what I wanted, right?
Yeah.
One of the things you really learn about social work is like that never works, right? And so people have to come to their own sense, and people have the right to make their own bad decisions. And social workers walk with you at any
through
point.
those decisions.
Through all those decisions, but
Yeah.
we don't make them. And when I can get my head around that as a social worker, I'm a lot less burned out because I recognize your autonomy to do the things you want and me as a support person rather than the person responsible.
For sure. No, that makes perfect sense. You know, people got to make their own decisions. And
that's right.
They got to make their own choices, and you just
It's
there
in
to
a
help.
democratic society. Exactly.
Yeah. You're just there to support them.
That's
in
right.
whatever decisions you make, and whether that be bad or good, you know.
That's
so
right.
No, that's great to hear. Do we have any more questions? I mean, those are really good questions too. So keep them coming if you got them. Okay. So this is recorded. So if you need access to this, if you missed some of this earlier, if you came in late and you missed some of the questions that we asked or some of Dr. Heidi's presentation, it will be available to you later on once we get this recorded and snipped and all those good things. So if you missed something, you'll be able to get it back, right?
And I just put my email in the chat because we're excited about your interest and we are here to guide you. If you're interested and want to learn more, it doesn't commit you to anything. And we're excited about your choice. So email me, reach out, let's talk. If you're in the area and want to come sit in on a class, we're happy to have you. We'd love to, even if social work is not your ultimate destination, we want to expose you to the profession and we would embrace helping you make those decisions. So reach out.
I was also going to say, if you want to ever talk to a current student about social work more, you can email Heidi and she can give you my email. So I would be happy to answer emails for any student who has any questions.
All right. Beautiful. So I'm going to make sure that everybody get it because for some reason it's just saying host and panelists, but I'm going to make sure I chat it to each one of the students and they can get it there.
And good luck to you all in making your decisions. These are big, important decisions, and it's great that you're taking your time to explore what your options are.
Indeed. Yeah, so we don't have any more questions. Y'all are free to go.